My name is Amanda Buckner, and this is my head-to-toe assessment, starting now. Action.
Love that.
I'm going to come in, knock on the door. I'm going to introduce myself to the patient. Hi, my name is Amanda. I'll be your student nurse today. Can you tell me your full name and birthday?
Yes, Allison Jones and 6/1/2000.
Can I see your wristband?
Absolutely.
Yes, you are. That is you. Okay. So real quick, I'm going to go wash my hands. This room does not have a sink, but I'm going to go find a sink and wash my hands for 20 seconds and then put gloves on. I will be right back.
Yes, love that.
Okay, I am back. I'm going to pull the curtain for privacy. And now I'm going to put some gloves on. Okay. We're first going to start with the full set of vitals. Have you had any surgeries on your breasts or your arms? No? So I could use either arm for your blood pressure?
Either arm is great.
Would you mind taking your arm out for me? Thank you.
Absolutely. Maybe. Maybe.
Okay, lay your arm heart level for me. Make sure your legs are uncrossed. And try not to talk for this, okay?
Perfect.
Oh my goodness. Her blood pressure is 118/75.
Yeah.
Okay, I'm gonna grab your temperature real quick.
Okay.
37.4 degrees Celsius. Now I'm gonna get her respiratory rate without telling her that I'm getting her respiratory rate. Respiratory rate is 16. Okay, now I'm going to get her pulse by getting her apical pulse. It's in the mid-clavicular line and 5th intercostal space. Ouch. Hurt my earrings. Sorry, I gotta push up your boob a little bit.
Do whatever you need.
We're gonna listen for 1 minute.
Sorry. You're fine.
All up in your business.
No, it's okay. We're the worst bro.
Cuckoo Pulse is 104. She's got some anxiety.
Yeah. Shit.
Okay.
I feel that.
Have you been having any pain anywhere? Is
No
there any
pain.
certain pain bringing you in today?
No pain.
Okay. So, next up, I'm going to get rid of these gloves, sanitize, and put new gloves on. These gloves stink.
They do. They reek. Like my hands like reek from it.
Okay, so the first thing we're going to do at this point is inspect her head and palpate all her head areas. But first I'm going to just look for symmetry in her face. Okay, can you smile for me? Can you raise your eyebrows? Okay, I don't see any visible asymmetry or anything on the head or face to note. Next I'm going to palpate. Any pain?
No.
Feels okay? So head shape, size, and symmetry are normal. Now I'm going to palpate her lymph nodes. Okay, nothing to note. I don't feel any enlarged lymph nodes. They feel even on both sides. And now I'm going to assess for her head movement. Okay, can you put your head to your chest for me? And back. And down to your shoulders. Other one. And then look left for me. Look right. Any pain with that?
Nope.
Nope? Okay. So her range of motion in her head and neck is pretty good. So now I'm going to move on to her eyes, but first I'm going to go wash my hands again, sanitize, and put new gloves on. Okay, hands are washed and dried. I'm going to sanitize and put on gloves before I touch her eyes. Sorry for wasting all your gloves. Oh, those ripped. Re-sanitize. New gloves. Okay, clean gloves on. Now I'm going to look at her eyes. I'm going to first look at her eyebrows, eyelashes, and take a look at the whites of her eyes, the cornea. We're going to look at her conjunctiva and the iris and pupils just to make sure everything looks okay first. And now I'm going to take my pen light and we're going to check for transparency of the cornea from a lateral aspect. Beautiful. Now I'm going to check her conjunctiva. I'm going to pull down your eyes a little bit just to check for anything unusual, for any discharge, overly redness, anything like that, over tearing, maybe dry eyes. Okay, so for this part, we're going to be checking perla and accommodation. So follow the tip of my pen for me, okay? Okay, watch the tip of my pen. Beautiful. And then from the side, I'm going to look at her pupils. Beautiful. They're doing what they're supposed to do. Okay. Eyes look great. I don't see any visible eye trauma or anything like that. So next thing I'm going to do is move on to her ears. I'm going to palpate her ears. Are you having any pain?
No.
I'm going to, again with my pen light, look inside. I'm going to look at the meatus, see if there's any kind of discharge, cuts, anything blood or gross coming out of her ears, and there's not. Okay. And then I'm going to palpate the mastoid. Okay. I'm sorry, brain fart.
You're doing good.
Okay. At this point, just because I'm gonna go assess her mouth and I was dealing with her eyes and ears, I'm gonna do her nose before I do her mouth, but I'm still gonna change gloves. Okay, I'm gonna palpate your nose and see if you're having any kind of bumps or anything. Is that painful?
Nope.
Okay, let's see if you can breathe okay in each nostril. Put one finger on one side, close it and breathe. Okay, other side. Okay, now I'm gonna look up your nose. You tilt your head back a little bit. I don't see any kind of deviated septum or any drainage coming from her nose or redness or anything like that. But now I'm gonna go to the mouth, but because I was touching everything else, I want to change gloves again and sanitize. Just takes a second to dry. Okay, I'm gonna grab a tongue blade and a my pen light again. Okay, open up your mouth for me. I'm just gonna kind of look at your teeth and gums first. Sorry. I'm also gonna look at the roof of her mouth, palate, uvula. Okay, stick your tongue out for me. Okay, say ah. Okay, stick your tongue out more. Okay. Do you still have your tonsils?
I do.
Okay. Everything looks great. Uvula is centered like it's supposed to be. Her mouth and mucosa, oral mucosa is moist. There's nothing unusual or cuts going on with the roof of her mouth, you know, cheeks, tongue, anything like that. Okay, now I need you to open your mouth again and move your tongue up and down for me. And now side to side. Okay. Okay, so, sorry, brain farts, guys. Now I'm done with the mouth. There's nothing to note there. I'm gonna throw out that tongue blade. Get rid of these gloves. I didn't see any like fractured teeth or anything either. I'm going to go wash my hands again because I was just dealing with the whole head area, so I'm gonna move on to lungs. So we're sanitizing after washing our hands, and now more gloves. Sorry, they can barely see me half of this video. Okay. So now for my patient, I'm going to just look at how she's breathing. Is she tripoding? Do her lips have any bad color, like bluish cyanosis or anything? Check her work of breathing. Sometimes people can tripod if they have a history of respiratory illness. She looks like she's sitting there okay, not having any kind of labored breathing, fast breathing, anything, or slow breathing, anything like that. So everything looks good in that sense. So now I'm going to find my stethoscope. I'm gonna listen to the 8 spots in the front for her long sounds, and then the 10 in the back. Deep breath, yep. again. And one more. Okay, I didn't hear any adventitious sounds in the front, and I don't know if you saw me, but I went in that motion as well. All right, now for the back, 10 spots. Beautiful. Other one. Okay, I didn't hear any adventitious breath sounds in the back either. Okay. I would note though if I heard any wheezing, rails, crackles, any kind of diminished lung sounds, but she sounds great, both with inspiration and expiration, so we're good. Okay. These gloves are getting sweaty, so I'm just going to change them again anyways. And then we're going to move on to the heart. So many glove changes.
I relate.
Huh?
I said I relate.
Yeah. Okay, the first thing I'm going to feel for is her carotid pulses individually so she doesn't pass out.
That's good.
Yeah, she's got some bounding pulses in her neck, so that's good. Because
Bounding?
I mean, some bounding pulses. They're just very easily palpable.
Oh.
Mine aren't.
I was like, oh
Okay.
no.
So now I'm going to listen. Oh gosh. I'm going to listen to the 5 spots using the ape to man technique for her heart. And I did already listen to the apical pulse for a full minute. So I'm just going to hit that spot again, but briefly. This is yours. Sorry.
Oh. I was like, you can use it. It's a good one.
Okay, I'm going to do the same thing again, but with the opposite side of the stethoscope. So I'm using both the diaphragm and bell. Okay, I don't hear any kind of murmurs, no irregularity, nothing like that. Now I'm having a brain fart.
Okay.
Okay. So now I'm gonna move on to her extremities. If she was wearing a hospital gown right now, I could take more of a look at her skin. We're gonna check for pressure injuries if she's immobile, any kind of scratches or scars, redness, any kind of deformity that you could see visually. I don't see anything. She's super red in the face though right now.
I get red, okay. Why do we have to say it?
Just kidding. But that's normal, so we're good. Okay. And then I'm going to just palpate on her arms and legs. Any pain? Nope. No pain?
No pain.
Now I'm going to use the back of my hands to test bilaterally for temperature. Warm. While I'm down here, I'm going to check the cap refill in the toes. Just less than 3 seconds, and bilaterally on the fingers. Also less than 3 seconds. So now I'm gonna have you give me your hands. All right, push on me.
Okay.
Okay, now pull me back. And give me a squeeze. And then on your feet, pull up. Pull your whole leg up. Oh, beautiful. And then push down. Same thing on this side, up and push down. And for the feet, push down and pull back up. Same thing over here, push down, pull back up. Okay, so now I'm going to assess all of her pulses, simultaneously except the carotids, to see if there's regularity and they're consistent on both sides. I'm going to start with your radials. Those are good. Brachials. Okay, and I'm going to go down to popliteal pulses. And then down to her feet. Both sets of pulses on the feet. So the ankles and then the dorsalis pedis. Sorry, I forgot the name for the ankle one. The posterior tip. I'm sorry. I did them. But yeah, I hope that doesn't get me because I'm having a brain fart for that word. Posterior tibial and dorsalis pedis. I'm pretty positive. Okay. We're good. I'm having a long day and I'm hungry.
I feel that.
Okay. I got the cap refills. I gotta kind of think myself through this next part. There's one more thing I needed to check. Just again about the when I palpate her arms and legs, I'm looking for any like masses, tenderness, any kind of like pain. We did the pushes and pulls, so all the pulses are good. I'd assess the toe cap refills also with the shoes off. And now we're going to have you lay flat in the bed.
Okay.
So we're gonna do the abdomen assessment. Buddy, move over. I know it's hard to get.
It's hard to get. Okay. I'm flat.
Okay. So I'm gonna pull the camera like here.
Oh, that's good.
So the first thing I'm gonna do, if this was a normal patient, I would still have my privacy curtain closed because I'm gonna have them lift their shirt up. Not on her, obviously, but I'm gonna just pretend like I'm looking at her stomach for any kind of like surgical scars, abnormal redness, any kind of masses or hernias, stuff like that. Some people have like gallbladder or appendix surgery. So I've inspected, there's nothing notable on her stomach. The next thing I'm gonna do is auscultate with my stethoscope. I'm gonna listen to each quadrant and mark it with my watch just for enough time that I can hear whether she's hypoactive, hyperactive, or normoactive. Okay. So I listened to each quadrant for 10 seconds each. In the top two quadrants, I heard 12 vowel sounds on one side and 9 in the other. So she, by that math, multiplying that 10 seconds by 6, she's got hyperactive vowel sounds. And in the bottom two, I heard 8 on one side and 8 on the other. So that would be also hyperactive if you did the math. I think it's because we're all anxious today. Everything's moving.
Everything.
Yeah, and now I'm going to palpate. Okay. Any pain?
Nope.
No pain?
No tenderness, no pain.
Okay, I don't feel any kind of masses or anything. And she doesn't have pain or tenderness. And I'm also going to note, if this was a different patient with her shirt up for me, note like the location of the umbilicus and everything like that. So now I'm going to kind of ask my patients if they have any kind of concerns about what we did, or if there's anything that I think was unusual that I'd want to document at this point in the chart. And whatever I document that I find abnormal, I can also report that to the doctor. And the last thing I'm going to do is I'm going to get my patient back into a comfortable position, get them the right position, see if they have to use the bathroom, anything like that, and leave them in a safe place. Then I'm going to head out, and after I ensured everything's done with my patient, I'll make sure they are decent, and then I can undo the curtain and head out, and we're going to wash my hands again, do some hand hygiene and sanitize, because we just did a whole head to toe assessment. But thank you for watching. Bye.